Welcome now to Health Wednesdays here on Wide Awake. My name is Veronja Stella, and without further ado, my guest is already here, Dr. Paul Bakowa, who is a general practitioner at ADDY Memorial Hospital in Kanyanya along Bahai Road. Now, this is a journey we are walking together with them, and we are so excited that every other week we get to learn something new, and especially about our health, and we get to know how well to go about it. Now, today, being the Men's Day, it only made it more right to discuss prostate cancer. What is it? Who is it? Who is that? Where is that? That is all we are going to be talking about the prostate cancer. Good morning, Dr. Paul.
Good morning, Ms. Stella. How are you doing?
I'm well. Does it feel like you are going to be the face of cancer if I catch you on the show? Because now, twice now, you're coming and you're talking about
oncology.
And yet you are a general. How are you doing?
I'm doing well. How are you doing?
You are the first man that I'm saying Happy Men's Day to international men. You didn't even know it's international. Did you?
No, but thank you.
Yeah, so my co-hosts and everyone else, nothing. Hey, we reserved it.
For me.
Hey.
That is an honor. I'm very
yeah, so how do you hope to celebrate the international? Because as women, we go for spa days, we treat ourselves, we meet up with the girls, we go for dinner, anything in the works like that. Never know.
Just another Wednesday.
Never know your wife could have something.
That may actually be very true.
Ah, all right. Now, today we're going to be talking about another cancer, and that's the prostate. Now, in my personal experience, I've had older people in my life get into this. I know at least 4. A former pastor, I have a relative, an uncle, and I know 2 other men within the neighborhood that have been affected by this. What is it, and why does it suddenly feel like our men, all the men out there, brothers, our husbands, sons, they are in danger?
Thank you so much. So, as you have said, prostate cancer is limited to the prostate. It can spread, but it starts, the primary source is the prostate.
Yeah.
So, why it really only affects men is because the prostate is an organ that is exclusively found in men.
In men, yes.
So, where it is found at the what we call the urethra. Okay. There is a tube that is supposed to move urine from the bladder outwards.
Yes.
So where it starts from at what we call the neck of the bladder, that's where you find your prostate. And its major function is in production of what we call seminal fluid. That's its major function.
Okay.
It has other functions, but that's its major function. So, because literally seminal fluid is only useful in men, that's why you're going to find it only in men.
Okay.
Now, as with all cancers, it's going to start by abnormal proliferation of cells. Cells are supposed to be formed and they die. But for some, it will be formed, an error will occur, the body will not check it, and then it will continue to proliferate.
Okay.
Now, as you have spoken very well, that you have actually, 4 people in your life who have prostate cancer, it tells you how common a condition it is. So, we do realize that it is the second most common cancer in men, second only to lung cancer.
Okay.
And it is the 5th leading cause of cancer-related death after lung, stomach, liver, and colorectal cancer. So it's number 5 worldwide.
Wow.
And it is common in men above 60 years of age. The book says about 53% of men above 60 will have it. And the moment you clock 85, 90% of men are going to be at risk of having prostate cancer. So as we do see, it is an ailment, an illness of the elderly. Does not mean that the younger...
When you're younger, you're...
But it is an ailment of the elderly.
Okay.
And our common theory behind its formation is what we call androgens. So androgens are hormones, male hormones, of which majorly there are 2, testosterone and dihydrotestosterone. So actually the second one is the biggest culprit, that we think it's going to go to the prostate and it is going to cause this proliferation. So the older you are, the more you have been exposed to these high levels of testosterone. That is why also African men are actually at higher risk of getting it than other ethnicities, because of the theory that African gentlemen do have higher levels of testosterone as compared to. It's arresting. There are some genetic things that we do, you observe it, but the exact theory behind it is, it's just an observation. It has been observed that African men have higher levels of testosterone, but why they do is
it's something you can't explain. Now, earlier on, you said something about when an error occurs. And I don't think I've ever had that when it comes to the body and how it functions. Where could the error, like, does the mind forget that this is supposed to go out? How does an error occur exactly?
So, errors actually occur every time. So, errors tend to occur during a process we call mitosis. So, when you have your every cell, the way you heal, the way we grow, every cell divides.
Yes.
So, the way they divide are two processes, but the one we're going to talk about is what we call mitosis. So when a cell is going to divide, remember that every cell is supposed to have what we call DNA, the genetic material of every cell. So it's supposed to multiply, it's supposed to duplicate. Because remember, it's one cell that is going to form two.
Okay.
So it's supposed to duplicate, it forms two. Now, during that process of duplication, errors can occur. So in case there are 4 what we call nucleic acids, there are 4 in number, majorly. Now, in case one is misread and you put a wrong nucleic acid that's supposed to complement, it might code what we call it coding. So those nucleic acids. So you come, let me say it's like an instruction. You go and read, then you copy it somewhere, and then you give someone, you know what, this is what I want you to do.
Right.
So, in case you have an error at that point, so you make a wrong instruction, the wrong instruction is going to be sent, and the wrong protein is going to be made. So that is how those errors occur. But normally, your immune system is supposed to come, checks every cell.
Detects it.
Detects that there's an error in this cell, then it kills off that cell.
Yeah.
But cancer cells are good at hiding from the immune system.
Okay.
So they'll literally show something that is normal, and yet inside what is going on.
Nothing to worry about.
So that is how those errors come to pass. But normally the immune system is supposed to clear them.
Okay. Now, I want us to talk about the early telltale signs of prostate. I remember when you were talking about breast cancer, you're saying that even as women, we could always go to the mirror, touch here, do this. Is that the case for men?
Now, the unfortunate part about prostate cancer is most times it's asymptomatic. So you're not really going to have those telltale early signs that you know the moment you see this, you have this, or this is what you can do, and you're always looking out for this. So, but the signs of prostate cancer, most of them, we call them lower urinary tract symptoms. So there's, as it's expanding, it's going to go, because the urethra goes through it, like it goes through the prostate.
Okay.
So if the prostate is expanding inwards, it's going to compress the urethra. So you get obstructive symptoms.
Okay.
So when you're, the commonest ones, they talk about, let me say, if you're going to start urinating, you use a lot of force, more force than you normally used. You feel that the bladder is full very faster than usual.
Okay.
Nocturia, so you wake up in the night, you go to pee about 4 or 5 times in one night. So you're not emptying very well. The stream of urine is also weak. You understand? So it's all about this obstruction that the bladder is going to cause.
Okay.
So with that, there are also others that are less common, such as passing blood in urine, what we call hematuria. For some, now for men, UTIs are not something that are very common. Yes, it's about the anatomy of the way the men's urinary tract was formed. It's not something that is very common for a man to get a UTI. They can get, but it's unusual. It's not something common. So when it does occur frequently, especially in the elderly gentlemen, then you start thinking, is there an obstruction? An obstruction can be, there are very many things that can cause obstruction.
Yeah.
But as of today's case, we're talking about CA prostate.
Yes.
So when a man above 60, 70 is presenting with urinary tract symptoms very often, so you start thinking, what
Then
may be the cause?
you start to be, oh wow. You know, you always teach me something. Now I'm stuck on that thing of how men really get the urinary infections. But let's go for a very tiny break. We're still having this conversation with Dr. Paul right here. So tell a friend to tell a friend that the conversation is already going. We are talking about prostate cancer. And yeah, initially I said let men come closer. But now, I mean, even the women, let's all learn about this, because it could be your relative or someone that you know that is going through this, and we have to have this knowledge with us. So please do not go away. We'll be back shortly.